Ladies and gentlemen, I'm a physicist, but I dare say pharma really needs cutting edge. Why? Because at the end of the day, whatever we present here in Doom is about these people, Anne, Jenny, and Robin. And you all know the story of Robin, yes? He committed suicide. He was diagnosed actually with a very aggressive form of early stage of Parkinson's, which is a protein-based and protein-related rapidly progressing disease. And sadly enough, there are 100 million people worldwide who are actually also suffering from types of diseases which could be cured with protein pharmaceuticals. The catch, and this is why protein pharmaceuticals is a ridiculously big market in America, only $170 billion, dominated by oncology, immunology, and diabetes. Diabetes alone is $40 billion, with plenty of people who need to suffer every year. The thing is, there is a very interesting catch about making protein-based pharmaceuticals, as also James presented before from Lab Genius. Well, it is very expensive. So average cost per drug is $2.4 billion, and you have only 12% chance of bringing your pharmaceutical to the market. You see, the catch is finding a molecule that will do something great, and this is really my boast to Recursion Pharmaceuticals, who are making an amazing job on this front, may not be enough if you want to make a protein, biologically and medically active protein. Your protein needs to be stable. It must be soluble, yes? You need to suspend it in water and administer it to your patient. And it cannot aggregate. Think here of egg white. After boiling it, it aggregates heavily. Turns into this white froth, and you can't reverse this process. These are realistic problems that pharma clients face worldwide every day, burning, on average, on a clinical trial, $2 million per day. Now, let me tell you the story of human insulin. So human insulin, shown on the left, is a protein made of 58 residues. Can you guess how much money and time it took to actually bring it to the form of the medical insulin all of you can buy in a pharma store? Guesses? How many billion dollars? Ladies and gentlemen, 30 years of research and development and $150 billion. This is what it took to actually develop human insulin, which treats diabetes and is sold by Eli Lilly as Humalog. Why is that? Once again, a very recurrent motive over here at Cutting Edge Forum. Protein as small as insulin may have more mutant combinations than the number of seconds in the universe. So in other words, none of us in this room has technology, science, or capability to screen the search space using only theoretical tools or experiments alone. And this is why we combine AI, biophysics, and very precisely tailored experiments. So I want to show you what we've done is we've created a proprietary combination of deep learning with classical computational biology tools, which were available for the last 50 years. Unfortunately, this is not animated because it's a PDF, but if you go to my Twitter account, I pinned on the top a video which demonstrates essentially how it works. This is the world's first demonstration of harnessing the power of deep learning to design protein in real time. And we presented it during JP Morgan Healthcare Investment Conference to the pharma executives who understandably didn't believe us that this could work. And they should not, yes. AI is supposed to change the world and change the pharma, but show me the money, show me the proof. Well, I'm actually very proud to demonstrate a little bit of work we've done on that end. So ladies and gentlemen, what we've done is we've pulled some few secret data sets that generated $95 billion for Pfizer and CogX. This database concerns protein which is called haloalkane dehalogenase. This is not a medical protein. If you inject this protein in your bloodstream, you will die. You will have anaphylactic shock. But this protein does something very funny. It catalyzes reaction which doesn't occur in nature. So this protein is a molecular machine which converts relatively crappy drug into something that Pfizer sells as Lipitor nowadays. Now, the catch was, this protein is not active at room temperature, so what Pfizer wanted to do is engineer it so that it would be active over a broad range of temperatures, so by boosting the temperature, you can generate more drug. Very simple problem. Well, not really. So they spent 4 years. They generated 143 mutants by hand. They use state-of-the-art engineering methods and the best protein engineers money can buy, and they have a lot of money, trust me. We had some of the colleagues actually working on that protein during these projects. So what I want to present are these two graphs. These graphs are money-making graphs. On the left-hand side, what you have is, on the x-axis, on the horizontal axis, expected improvement of the protein expressed in degrees of Celsius. Essentially, the more to the right you are, the better the mutant will be. On the y-axis is something which we call the pseudo-free energy of every mutant. Essentially, in physics, we say the following things. The lower the energy state of a protein, the better it will be. On the left-hand side, I'm plotting predictions for 143 mutants against the experimental data for the state-of-the-art computational method published by University of Harvard last year in Nature Biotechnology, which is the standard for us scientists. On the right-hand side is the outcome of our method. So I hope that you can see that essentially we are kind of capable of predicting thermostability just on protein sequences, but there is a very important other message from that graph. You should see very distinct two groupings of the data points. The points on the left, vertically stretched, this is $90 million Pfizer spent on research and development. These are all the mutants, and 90% of the mutants actually, which yielded absolutely no improvement. So summarizing very quickly, with our deep learning platform, which combines classical computing and few very primitive biophysical experiments, we are 450% better than human beings. We are 12,000 times faster than human beings. And we've done something really bizarre and something which made us repeat these experiments 3 times. We detected that we are destabilizing something which is called the intrinsically disordered protein state and affecting thermodynamic equilibrium of protein going from unfolded state to folded. We have destabilized parts of the protein which look like spaghetti chain when the protein is being produced in the cell, and introduce charge which creates repulsion. The funny thing is when we return these mutations to scientists, they look at us and say, look, that just makes no sense. This just cannot work. Well, it doesn't make sense for me either, but it makes sense for machine. Thus, deep learning platform was capable of predicting mutants which have 0 to no chance of occurrence in nature. Now, of course, there is a next big thing that we want to do. This protein is patented, yes, so it's heavily protected by Pfizer. And since our platform runs on Amazon, because Amazon, they are good guys, allowed us to scale it, we thought, you know what, why should we stop on one protein? There are 12 million protein patents we have just downloaded. So essentially what we want to do is we want to generate derivatives of existing protein patents for thermostability, solubility, and aggregation, and go back to our pharma clients with new repurposed IP. Of course, every single protein is a new patent, yes. Now, very quickly, I just wanted to mention here all my friends and collaborators. Understandably, what we do is not my achievement and the fault of many amazing people. Especially, I want to mention my team, Matt and Emanuele, and Sir Christopher, who was awarded knighthood by Her Majesty last week. And I want to mention specifically Melinda and Bill Gates Foundation for good old times at Cambridge, thanks to their support. Ladies and gentlemen, thank you so much.